We will talk about retinal detachment. It's important because if left untreated, it causes permanent blindness. What is retinal detachment? Retina is light sensitive layer in the eye. If it detaches from underlying tissue, it causes visual loss and eventually blindness. That's why we should know what is its symptoms. We need to diagnose it promptly and treat promptly until blindness develops. Flutters and flashes are very important symptoms. It means tiny spots or tiny specks or cobwebs or strings in visual field. You can see these tiny webs or tiny strings in visual field, and flashes also characteristics. Actually, they are small part of cells which shadows the retina, and we see them as a flutters and flashes. They are important symptom, and patient will say that he feels some flutters in his or her eyes. This symptom can last for several minutes, for several seconds sometimes. It can last for several weeks. And after this, curtain effect occurs. And curtain effect is alarming symptom actually. It's like curtain in visual field, and its shadow veil, they symbolize progressing detachment. After curtain effect, visual acuity is lost and it needs prompt diagnosis and same day treatment. Now let's say what are risk factors. Usually it develops after 40 years, and more common among men. Myopia is strong risk factor. For example, if person has -6, it has -6 dioptric, this man has 10% risk of retinal detachment, while if person has -3, for example, he has 2.5% lifetime risk for retinal detachment. That's why myopia is strong predictor and strong risk factor for retinal detachment. Trauma also important. Sports, especially boxing, martial arts, and surgery. Multiple cataract surgery also increase risk of retinal detachment. Now let's say how we diagnose. The gold standard of diagnosis is dilated fundoscopy, which means direct visualization of retina via ophthalmoscope, and optical coherence tomography also used, and ultrasonography also used. Treatment is surgery. We have different types of surgery like pneumatic retinopexy or photocoagulation or cryopexy, and laser treatment, also scleral buckle procedure, which is employing a silicone band to reattach the retina, and all these surgeries have high effectivity. For example, pneumatic retinopexy has almost 80% effectivity, while scleral buckle procedure has almost 90% success rate. And prognosis is highly dependent of day of diagnosis. When curtain effect occurs, full day restoration of visual acuity is possible. So if you do surgery same day when patient experience curtain effect, full restoration of visual acuity is possible. But if you delay diagnosis and treatment, then you can only achieve around 50%, sometimes more, of visual acuity. That's why prognosis is highly dependent how fast you diagnose this disease. So every person who are under risk retinal detachment should regular checkup with ophthalmologist for retinal detachment. And such people are people with diabetes, people with myopia, people with who have lots of trauma on eyes, such as boxers and martial arts athletes and people with lots of surgeries on their eyes, they need to pay attention the retinal detachment. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.